Welcome to Your Senior Center. I'm Vicki Lowe, and my guest today is Maureen Cardarelli. Maureen is our public health nurse, and we have a Health Beat segment that she's going to be doing regularly on the show. And today's topic will be shingles. Welcome.
Thank you for having me.
So can you tell us what shingles is?
Shingles is a disease that's caused by the same virus that causes chickenpox. So anybody who's ever had the chickenpox can potentially later in life develop shingles. And what it is a reactivation of the virus. After we have chickenpox, the virus can hide in they're called the nerve root ganglion, which is all along the spine. We have the little bulb at the end. It's the base of the nerve. The germ hides in there, and then it can travel up that nerve and out to the skin and cause a very painful rash. And key word here is pain. Mm-hmm. It's a very painful condition, and it's a blistery rash that goes on for about 2 weeks and has some potential complications. So we absolutely don't want to have to develop it, but it is quite common. They estimate that 50% of people over 85 will have had it at least once in their lifetime. So the other thing to know is that about 98% of people over 60 have likely had chickenpox, so that's a pretty high percentage of the population who are actually potential candidates to develop the condition.
Now, we all know that chickenpox is contagious. If you have shingles, are you contagious to other people?
You can be, not in the same way as chickenpox. Chickenpox is spread by coughing and sneezing. People would, breathe in the germ and then be able to come down with the disease if they've never had it. And it's also contagious by contact with the fluid in the little blisters. In chickenpox, there are scattered blisters throughout the body, whereas in shingles, it's in a concentrated area. At the end of that dermatome is where those blisters would be focused. And contact with the fluid from the blisters when you have shingles could likely cause chickenpox in a person who's never had it. So you can't catch shingles, but you can catch chickenpox from a person who has shingles.
So it's really only contagious to someone who's never had chickenpox.
Exactly.
So if I've had chickenpox and you have the shingles, you can't cause me to have the shingles because it's caused because of this virus laying dormant in your system.
Right.
Okay.
And I guess that would need to lead to the next question, which is, what would cause it to happen if I've had chickenpox? Why would I develop shingles? At what point?
Years and years later.
Yeah, and, it can happen in very young people. We've seen cases in children, but typically it happens in people who are over the age of 60. About half of the cases each year in the United States are in people that are over the age of 60. And it's during times of stress, during times of illness, and during times of decreased immunity. So for whatever reason your immune system is weakened, it may be by taking steroids for another condition, it may be because you're on chemotherapy for a medical issue, so anything that would reduce your immunity, or just the illness itself can cause reduced immunity. Sometimes people who are post-operative will develop it because at that time their immune system is working hard to repair the, whatever the insult to the body was with the surgery. So all of those things can cause a person to develop shingles. There was some question about whether sunlight would trigger it, and I don't think that's ever been confirmed. I think it's more of stress and illness and suppressed immunity.
Okay. How would someone know that they have, or what would be the key symptom that someone would know that they need to seek medical help, that they may have shingles?
Okay. The most common early symptoms, you could start with a little fever, a little headache, maybe some chills, some nausea. Typically what people are aware of is there's some pain. They can't really define that they had an injury. They're not quite sure what this pain is all about. I'll give you an example. Someone I know had tremendous pain in their arm. They suffered with this arm pain all weekend long. I don't know what's wrong with me. My arm is absolutely killing me. And when I saw this person literally they were writhing in pain, could not stand still, so uncomfortable, the entire arm. And it had been going on, I saw them on a Monday, it had started on a Saturday, spent the whole weekend just so uncomfortable with this arm pain. That was the first sign. And when I said, well, is there anything else going on? Well, I have this rash. Can I see the rash? And sure enough, there were blisters all the way up and down the arm. So typically you would have the pain or maybe some tingling in the area that it breaks out before the rash even shows. Mm-hmm. So a lot of times people will have gone to the doctor because they have this pain that they can't put their finger on why they're having it, but it's uncomfortable enough that they feel they need some medical attention. And quite often the diagnosis can be delayed because if there's nothing visible, you could have in the back of your mind that it might be shingles, but without seeing the rash, it's not a definitive diagnosis. And so, it may be not until some blisters appear that the connection is made between this significant pain.
How long is it between having the pain and having the rash? I mean, is there like a typical time frame? Or?
I don't know the answer to that question.
Sure.
Yeah,
but
I don't.
It's probably within days or so.
I'm sure it's within days. Yeah, I didn't find anything in the literature that said exactly what the time frame was, but I believe it's only a few days between the development of the pain and the development of the rash. I want to say 2 or 3. I just don't recall seeing it in writing anywhere.
How often can someone get shingles? Is that something once you have it, like the chicken pox, you don't get it again, or can you get it several times?
Unfortunately, you can get it again. Some people do, some people don't, and there's no way to know who will or who won't develop it again. I have known of people who have had it recurrently, maybe 3 incidences in their lifetime, and I've known of other people who've only had it once. It can be in a different area than it was initially. There's estimated that there's about 1 million cases of it in the United States each year, so it's quite common. Really
I had actually seen a little segment on television about shingles, and it said 1 in 3 people in the United States will have shingles in their lifetime.
That is absolutely true.
Just an overwhelming statistic.
It's huge. And when you think about it, that over the age of 85, it goes up to 1 in 2.
Yeah.
So 1 out of 2 people over the age of 85. So if you're lucky enough to live a nice, ripe, long life, your odds of getting shingles increases pretty significantly.
Can you show us what the rash looks like?
So I absolutely can. I'll hold this up to the camera. The top picture is the side of a person's body. It looks like kind of a chunky gentleman, and then the bottom is a close-up of the blistery rash. It's usually a reddened base with fluid-filled blisters, and
so are they blisters that crust over?
And it takes about 2 weeks for the rash to resolve, but ultimately it will crust over. And the other thing to note about this particular rash is that the technical word for it is it stops at the midline. It's only going to be on one side of the body. So if you have, is that long enough now? If you have it on your trunk, it would stop right in the middle or right in the middle of your back. It's only going to be because the nerves in your spine, there's one on this side and one on that side. So this side controls the left side of your body, that side controls the right side of your body. So as it travels up the nerve and out to the skin, it's going to stop right at the midline because it's only on the side where that particular ganglion was located, if that makes any sense.
So what are the long-term effects of having had shingles?
So unfortunately, the long-term effects are, the most typical thing is, it's called post-herpetic neuralgia. And the best word for that is pain. The pain that happens with the rash, so it starts with pain prior to the appearance of the rash. Then the rash, after about 2 weeks, crusts over, heals, and resolves. It can leave some scarring, which can be disfiguring, especially if it's on a person's face. That can be a significant change in their lifestyle, that they've had this tremendously painful thing that left scarring on their face. But the pain can persist for... And the way it's worded in all of the literature is up to a year or permanently. So there are people that'll have pain for a couple of weeks, a couple of months, and then when it starts going on a year or even longer, it could be a chronic thing. They could have pain for the rest of their lives, which is really devastating. The reason for that would be the damage that it's done to the nerve all the way as it traveled up the nerve and out to the skin. And that in and of itself, having that chronic pain, is a huge lifestyle change. It's very devastating. And the effects of having that, I actually wrote down a little list of the things I was finding as I did a little more research on it. So the effects of the long-term post-herpetic neuralgia or pain: chronic fatigue, because being in pain is exhausting. And loss of appetite, weight loss, physical inactivity, because who wants to go out and play tennis when they have this tremendous pain in their side or their arm or their face? Insomnia, again, pain keeps you from sleeping comfortable. If you can't get comfortable, how are you going to ever sleep? Anxiety, difficulty concentrating, depression, suicidal ideation, social isolation, and it can interfere with the activities of daily living, such as bathing yourself, dressing yourself, grooming yourself. So all those things can be affected, and it really does depend on what part of the body the shingles had presented. What the long-term effect of having pain in that area is. But, it definitely varies from person to person and can be entirely devastating. And the other thing that's not really mentioned in the lists of long-term effects, because the person is in this significant pain over this long period of time, substance abuse. And I'm not going to say that with like a negative connotation that a person is, say, drug-seeking, but this person is in so much pain. The drug regimen that it requires for them to even take the edge off of it and have a little bit of comfort. We all know that if you're using narcotics, that after a while the effects, you need a little more to, they just sort of become immune to the effect of the drug. And so the regime that they end up being on to try to control some of the pain just it's over the top. And then the effects of the constant ingestion of these very powerful drugs takes its toll on the body as well.
If somebody has a recurrence of shingles, is it generally in the same place? I mean, if it's lodged itself or is laying dormant in a nerve, does it always go to the same nerve, or could it be in
not
multiple?
Necessarily. It can be in a different place. I did know of a woman who had it in her leg in the same spot a few times. But, typically it's somewhere else. Or, I shouldn't even say typically. I don't think that there's any pattern necessarily. Yeah. I think it varies.
Just wherever it
varies,
happens to be
but it certainly can happen again, which is unfortunate.
Now, what can be done to prevent, it sounds like it's so horrific. What can be done to prevent getting shingles in the first place?
There is a vaccine that has been on the market. It's called Zostavax, and while it's not 100% effective, it decreases the incidence of the disease by about 51%, and in people who do actually get it, the complication of post-herpetic neuralgia is also reduced. So what it does is it's a weakened form of the chickenpox virus, so it's like a super chickenpox vaccine. And the belief is that as we get older, when we catch the chickenpox, our body builds up antibodies, and those circulate in our bloodstream over the course of many, many years. But the belief is that as we get older, that the titer, the count, the number of antibodies we have starts to decrease. And that by boosting that with a vaccine, it has some protective factors against developing shingles.
Well, 51% chance of having it, of not getting it, doesn't sound like much until you think of it means 1 in 6 people instead of
1 in 3. Exactly, I know. And the other thing is not having the long-term complications, reducing the risk of those long-term horrible complications. If anybody's interested in doing it, they can certainly Google all of the photographs of this awful disease, and they're going to come across. There's one in particular that gets shown. It's one of the CDC photos, and there's a woman who, half of her face is all, it's crusted over rash at the point that they took the picture, but you can see the devastation right down to the tip of her nose, the eye, the ear, everything in this part of her face is affected by it. And unfortunately, they don't show an after photo where you can see how much scarring was left. There's no follow-up to say this person's vision or hearing or whatever was affected. But those are actually if it happens on the face, it can damage hearing and vision. And those kind of things, again, permanent, lifelong changes that are undesirable. So you're absolutely right. To get a vaccine that reduces the chances of long-term complications is well worth the trouble. Having said that.
Yeah, who is the vaccine recommended for? Is it seniors or people who are younger? Or?
Right now, the CDC recommendation is for persons over the age of 60. So the vaccine is approved for people who are over 60. There is some talk about people 50 and over getting it, but FDA hasn't made that approval yet, as far as I learned. And so it can be used, they call it off-label. So if a physician chooses to vaccinate their under 60 patient, that's their prerogative to do that. But the recommendation is still for 60 and over. And
does insurance cover it?
Insurances do cover it. It gets a little sticky. It's covered by Medicare Part D. The copayment varies depending on which plan a person has. And the private insurances, a good number of them do cover it. There are a few that don't. My recommendation is it's become widely available now at the retail pharmacies. You've probably driven by and seen signs, shingles vaccine available. My recommendation would be that you call your insurance company, ask them if they cover it, and ask them, is it covered if I receive it at a pharmacy rather than a doctor's office, because that may be a sticky point for some of the coverages. The cost of the vaccine, if you were to purchase it at one of those retail pharmacies, is about $220. And the co-payments vary from about $20 up to, I think I heard $90. And I did have a woman call me a couple of weeks ago and say to me, well, I was told that my co-payment will be about $60. I think she said $60 or $65, and I was hoping that I could do better than that. And my answer was, I really think that's a good deal in today's climate, because if you had to pay for it retail, you're looking at $220, and availability of it is not, most people are told that they're not able to. If they're told that they're not covered by insurance, that's going to be a lot of money out of pocket. So if you can get it for $65, I think that's pretty good. And I really hate to say it that way, but it actually is one of the better deals that I've heard through the insurance companies. And it does vary widely.
When you just go to your doctor to have a physical, you can inquire about this vaccine. It's
absolutely, yep.
So it's not something that the doctor has to decide that you're at risk and you need it. It's that if you're over 60, you can ask your doctor at your regular physical.
Yep.
Do doctors have the vaccine in their offices as readily available as the pharmacies do?
Yeah, some of them do and some of them don't. And what I've seen is that doctors in family practices, they would have, so the chickenpox vaccine and shingles vaccine need to be stored frozen. So pediatric offices have the freezer that maintains the temperature to store the chickenpox vaccine. So in a family practice where they're seeing children and doing well care visits for children, they would have that freezer because they are required to provide, all the childhood vaccinations. So they may be willing to purchase that shingles vaccine because they already have a freezer to store it in. Some of the internal medicine practices, it's quite cost prohibitive to them to purchase the freezer and monitor the freezer and then purchase the vaccine with the risk that they may not actually use all 10 doses before they expire. So when they're looking at, balancing between their obligation to protect the patient from this disease and the costs and the losses that come with, it's a business, so they really have to be careful that they don't, purchase themselves out of business. It's a very expensive vaccine. Some of them choose not to do it, and they recommend that, they'll tell people to call the public health nurse, and unfortunately the state does not provide this vaccine, so some of us don't have it. Some of us are not able to purchase it to offer it out to clients. So, the next step is to check with your local pharmacy, and if they do offer it, they can pretty much tell you whether your insurance covers it and what your copayment would be. But again, I recommend that you call your insurance company, because you do want to be sure that if it's administered outside of a doctor's office, that they do, in fact, cover it and honor that copayment.
I actually had that experience going to a pharmacy and getting a vaccine. I think it was a flu shot at the time, and I thought it would be covered, and they told me that my insurance covers it and all of that, and that I would submit to get reimbursed. But when I spoke to my insurance company, because I hadn't called them first, when I spoke to my insurance company, they said, we only cover an inoculation that's administered by a physician or a nurse, not a pharmacist. Yeah. So it wasn't even the vaccine, it was who was administering it.
Right.
So that's really good advice to tell people to first call to find out, and then so if you really insist with your doctor that you want to have this vaccine, can the doctor figure out a way to get the vaccine or refer you to a physician's office that can give it to you?
They don't typically like. I don't know if it's that they don't like it. I just don't know that insurance-wise that they would honor that referral. I want to go back to what you said about. Just to reiterate, if a pharmacy says, we'll give you a receipt and you can submit that to your insurance company for reimbursement, that's a red flag. Please don't fall for that. Always check with your insurance company first. Yeah. But to answer about the physician is likely to say, call your public health nurse or call a pharmacy and see if you can get it there. I don't think they can refer to another physician who does offer it. There have been physicians who will write the patient a prescription, and they take that to the pharmacy, and they can pick up that vaccine, and if they can pick it up and return to the doctor's office and have it administered within 30 minutes of it coming out of the freezer at the pharmacy, then they can have it administered. So there have been cases where that's the plan that they choose. However, it's not ideal. The base cost of it, like the wholesale price, is about between $150 and $160, depending on whether you buy a single dose or a 10-dose box. And if it stays out of the refrigerator or freezer for 30 minutes, it's not administered. Within that 30 minutes, it's considered no longer viable. And so that's an awful waste of $150. Yeah. So you get stuck in traffic between your pharmacy and going back to your doctor's office. Or you get to the doctor's office and they're just so busy that they can't attend to you within 30 minutes. You've just wasted the money that you paid picking up your vaccine. And I highly doubt that an insurance company would pay for it a second time when it was like a human error that caused it to be not viable. So.
Now, once someone has had the shingles, when can they have the vaccine right away? I mean, the virus is in their body, but can they have the inoculation?
So, the answer to that is that there is no time interval. We used to say you needed to wait 18 months, and I don't know why that now, when I looked this up, no time interval, but ideally wait until the rash is gone and discuss it with your primary care provider about whether or not it's a reasonable option for you to then have that vaccine. Again, the purpose of the vaccine is to boost that antibody titer, which, having the shingles doesn't seem to do. So, definitely.
So it's really giving you an inoculation against chicken pox.
That
is the thing that's causing the shingles to erupt.
Yes.
So that makes sense. So it's not that you've had the shingles and your body is building up antibodies against the shingles, because it's something that's in your body.
Right. Well, and it's still that varicella virus. So, and there are a few people that actually should not get the shingles vaccine. There are people who are on treatments that reduce their immune system, whether it be steroids or chemotherapies. So, it is wise to investigate that, check with your doctor. Is there any reason why I shouldn't have it? Is there, And so, it's
I
just
was thinking of
important to
asking
do
you that
your
question.
homework.
If you were a physician and your patient is going to be having chemotherapy or high doses of steroids, would you preventatively tell them that they should get the shingles vaccine because you know that they're at a higher risk to get it?
Yes.
But maybe...
Yes.
Okay.
Yeah, good question. Absolutely. Ideally, you would have it as soon as the decision is made, because you want them to have the reduced risk of developing it while they're on their chemo treatment or steroid, whatever it may be. So yes, and it'd be nice if they could wait a month after having the vaccine to start that treatment. But again, that's a discussion to have with the specialist who's going to be providing the treatment.
You mentioned that there's only about 2% of the population of people 60 and over who haven't had the chicken pox. Can you talk a little bit about people who haven't had the chicken pox and what all of this means to them in terms of being vaccinated and at risk of being exposed to somebody who has the shingles, that type of thing?
So absolutely. Somebody who's never had the chicken pox, well, the first thing is when we're talking about administering shingles vaccine, the recommendation is that you don't ask if they've ever had chicken pox because the presumption is that 98% of us have had it, and there are what they call subclinical cases of chicken pox. So, when we were growing up, somebody in the household would come down with it, and then everybody in the household would get it within a couple of weeks. But there would be that huge blistered, head to toe kid, and then there'd be one kid who had maybe one lesion, or a kid that just had some sniffles and didn't actually develop any of the blisters. But if you were to test them, they had it. They would have an antibody titer. So the thinking is that if someone isn't sure whether they ever had it or not, go ahead and vaccinate them, because chances are they did have it. If someone never had it and they're exposed to somebody who has the shingles, well, we do recommend that anybody who has the shingles, if they know that they're going to be around other people, especially pregnant mothers who have never had chicken pox or newborn babies, because they don't get their first vaccine until they're about a year old, that if the rash is on a spot on the body that can be covered, that you cover it. Because any contact with that fluid could potentially cause chicken pox in a person.
Fluid that causes
with shingles, absolutely.
With shingles.
Whereas with chicken pox, it's coughing and sneezing, same as a cold, that we spread it, same as like a cold or the flu. And so that can't happen with shingles. It's only contact with the fluid with shingles. So, we do ask, when the diagnosis is made, typically the person gets asked, who's in your circle of family and friends? Are there any newborns? Are there any pregnant women? Are there any, people who are on suppressed immune treatments or have conditions that suppress their immune system? And, then the advice is that while you have oozing, if there's fluid there present, that you not be in contact with that person.
Yeah.
And, I worked in a pediatric office for many years, and a typical phone call was from a parent or a grandparent saying, so-and-so's been diagnosed with shingles. Is it okay for them to be around my children? And those are the guidelines we follow. If it's in a place on the body that can be covered, with a bandage or clothing, then please, by all means, cover it and avoid contact, because it really is the safest thing to do. But if it's, if it's on your face and you can't put a patch over your entire eye because you need to be able to see, then just stay away from people. Yeah, just stay away. You probably don't. I know. The truth is that people with this disease, when it happens, they are so sick and they're so miserably uncomfortable that they really don't, unless they have to. I did know of another woman who had it recently, and it was on her trunk, and went to work because she said, I'm going to be in pain at home, and that's all I'm going to think about, at least at work. I'm busy and I'm preoccupied. Exactly. And so took an ice pack and just held it under her arm for most of the day, and that was enough to just keeping busy, and keeping the ice on it was enough to make her happy to be at work instead of at home writhing in pain.
Are there ever subclinical cases of shingles where someone just gets, like 3 or 4 lesions, or is it always this horrific rash?
Very good question. I actually do think that a woman I know, my mom recently, had a kind of a subclinical case. We had been out, and I noticed that her neck was very red. I thought it was from a necklace. I thought it was like a contact dermatitis. I said, Mom, did you know your neck's really red? What's going on there? And then a few days later, this same area was it was burning, it was bothering her, and she said to me, I think I have shingles, and went to see the doctor, and they agreed with her that it was very possible that this was early shingles. She had had it before, so she kind of knew in her own body what it would feel like, and they decided to go ahead and do an antiviral right away to prevent it from getting any worse. And it really didn't amount to much, so I don't think we'll ever really know whether it was that or something else, but it's better. So
now, when you were saying they gave her an antiviral right away, what's the importance of someone getting to the doctor immediately to start those antivirals if they feel like they might have shingles?
Exactly. That was my next statement. We haven't talked about treatment yet. The best thing is that if you suspect that you have it, get to the doctor right away. The sooner you can start on an antiviral and suppress it from continuing to break out and get worse, the better the outcome. And the best scenario is that you get on that antiviral within 3 days of developing, the first sign of the rash. And the
first sign of the rash or the first sign of the pain? Does it matter?
First sign of the symptoms.
Yeah, okay.
And so, there are a lot of different things that they can do for comfort. So there are things like lidocaine patches that you apply to the area. So it's a topical anesthetic medicine that would just reduce the pain right at the site, of the skin. But some of the pain is nerve pain, so that's from the inside. So there are medications that get used, like Neurontin. They use, things like Percocet or any of the Vicodin, any of the stronger analgesics. Simply something like Tylenol, or sometimes they'll do steroids to try to calm things down. So there's kind of a wide range. There are things that people use. There are homeopathic remedies. Again, talk with your doctor if you're going to be thinking of trying something that your neighbor's cousin recommended. Really, it's a good idea to check into those things. And the reason I say that is one of the common homeopathic things that are recommended by a lot of people is capsaicin, and it would be the same type of thing. It's the oil from peppers, hot peppers. And so people like to use that for arthritis. So if you have a sore joint and you put that cream on your knee, it's actually got that hot pepper oil in there, and what that does is that it actually can cause a little burning sensation on the skin. But what it does is it interrupts the pain pathway, and so instead of feeling the pain within your joint, it tricks your body, and so all of a sudden you don't notice the pain in your joint. Not to say that your knee is burning on fire. I did try it one time. My husband. So you just have pain in your skin. I have a little arthritis. My husband put it on my hands, and I thought, "Are you kidding me? My hands were on fire, and this is not comfortable." But there are plenty of people that do believe in it, and they use it with excellent success. But I have to warn you that if you have already got inflamed skin because of this rash, and you apply a hot pepper compound to your skin, you may cause yourself a lot of discomfort. So be very careful about, what people recommend until you've checked with your doctor that it's, safe and reasonable to use under the circumstances. But again, the take-home message is the sooner you can get to the doctor and bring up the possibility of the diagnosis, the better for the outcome. Those antivirals do settle things right down. And having said that, too, there are times when people have completed their course of antiviral and the rash would start to flare up again, so they need to go on a second course. So communicate with your healthcare provider. Most
that's really good to know.
Yeah, most offices have a nurse to speak with, and people will say, "Well, I didn't want to bother them, so I didn't call." That's their job. That's what they're there for. There is no reason for you to sit home with your discomfort. call them. Is there anything else I can do? It's such an awful, especially if the providers never experienced shingles themselves, they need to have a little compassion about this. This is tremendously painful. Mm-hmm. It is tremendously disruptive to a person's lifestyle. And the knowledge that the pain can persist long term for months or years weighs heavy on a person's mind when they're home suffering with this horrible pain. So again, the sooner you get to the doctor and get your diagnosis and start on your antiviral treatment, the better. But that doesn't end the process. You don't just go home and take your antiviral and that's the end of it. When you have questions and concerns, call and discuss it with your provider, because it can be quite a long, drawn out, awful experience, and you need the support of the people who are trained to handle these kind of cases.
I know that you have a little diagram of sort of the map of the nerves of the body. Can you show that? And again, it's just one side of your body that would be affected if you have shingles, correct?
So yeah, this little page demonstrates what are called the dermatomes, and it's probably, just to get a picture of it, each nerve, I'll show you the nerve first, each nerve, where'd it go, has a little root. So this is a picture of what would be the spinal, a couple of the vertebrae. And so this, let's say this bottom one is one vertebrae. This little bulb here would be that nerve root ganglion. So it's the little bundle of nerves within that outer sheath. Mm-hmm. And then you can see the lines. Those lines would be the nerves, and they would travel up and outward toward the skin. So it's from the spinal cord out to that nerve root ganglion and then out to the skin. And then this one is each different region. So each little nerve follows a pathway. So if you were to have, like your vertebrae, say, in this area, it would be, this section of the body that it would bring it out to. Some that bring it out to the, neck and shoulders, some to the head, some to the arms, some to the leg. But it really depends. This is probably not the best diagram I've ever seen of it. But it depends on which one activates where on the body the symptoms end up being.
Okay. It seems like we've pretty much covered shingles and the vaccine that's available. What is your kind of final take-home message to people who are watching?
Okay.
I think you did say
at
that
risk of
being
sounding like a broken record, if you think
okay.
you may be developing shingles, get yourself to the doctor right away, and get the opportunity to be put on that preventative antiviral treatment to just kind of halt it in its tracks and keep it from getting a lot worse, because the long-term complications can be devastating.
Okay.
And get vaccinated.
Yeah, and good. I want to reiterate that. All right, well, thanks very much for being here.
Thank you for
having
me.
It's great having you, and we'll be continuing the Health Beat segments with our public health nurse, Maureen Cottarelli. Thanks for coming.
Thank you.
I went through the list when you were holding up the picture.